looking at Integrated Reproductive Health, IRH 2019 paper. So go straight to the multiple choice questions. Question 1 says, which of the following is a routine laboratory investigation for a pregnant woman? So the correct answer is D, which is urinalysis. Question 2, the ability of the uterine muscle to relax and become shorter with each contraction is known as? The correct answer is D, which is retraction. Question 3, when using a pantograph, an alert nurse would determine a difficult labor by following indication. The correct answer is D, which is cervical dilatation below 1 centimeter per hour. Question 4. The process by which the product of conception are expelled from birth canal after 28 weeks of gestation is known as? The correct answer is B, which is labor. Question 5. The second stage of labor is divided into two phases, namely, the correct answer is A, which is descent and perineal phase. Then we go to question 6. A retroplacental blood clot is a diagnostic feature of? The correct answer is B, which is placenta abruption. Question 7. The return of the reproductive tract to non-gravid state is known as? The correct answer is B, which is involution. Question 8. The neuromuscular harmony that exists between the lower and upper segment of the uterus is known as? The correct answer is C, which is polarity. 9. Intrauterine contraceptive device is contraindicated in which category of family planning clients? The correct answer is B, with someone with concurrent partners. Question 10. What are the two factors that bring about involution? The correct answer is B, which is ischemia of the myometrium and autolysis. Question 11. Autolysis is also referred to as? The answer is D, which is self-digestion. Question 12. In a gynecoid pelvis, the smallest diameter of the pelvis outlet is? The correct answer is C, which is antero-posterior. Question 12. The small fissures between the lobes of the placenta are called? The correct answer is for 13 is B, which is Sulci. Question 14. The primary risk factor for ectopic pregnancy is a prior history of? The correct answer is D, which is pelvic inflammatory disease. 15. Profiling in family planning counseling is done by? The correct answer is B, which is grouping clients according to reproductive goals. Question 16. One of the following is true about Jadel, and the correct answer is C, is that it causes a small increase in ectopic pregnancy. Question 17. The key principles governing sexual reproductive health and HIV linkage. The correct answer is B, which is focus on human rights, gender, and promote coordination and coherent response. Question 18. The hormone produced by the corpus luteum is? The correct answer is A, which is progesterone. 19. Menstruation is as a result of? The correct answer is C, which is a fall in progesterone level. Question 20. The pelvic brim inclines at an angle of approximately? The correct answer is A, which is 55 degrees. 21. Of course, in normal pregnancy, the presentation of the fetus at 36 weeks is? The correct answer is A, which is vertex. 22. Organisms commonly associated with infection of the female urinary tract include, the correct answer is D, which is Escherichia coli. 23. The commonest causes of pelvic inflammatory diseases are, the correct answer for 23 is B, which is chlamydia and Neisseria gonorrhea. 24. STIs in women can be associated with, the correct answer is B, which is cervicitis. 25. The hormone which controls secondary male sex characteristics is the correct answer is D, which is testosterone. 26. Which of the following is a symptom of menopause? The correct answer is B, which is dyspareunia. 27. The common site for development of cervical cancer in the endocervical canal, where the vaginal and uterine epithelium meet, is referred to as, the correct answer is A, which is squamous columnar junction. We go to 28. During pregnancy, the proliferation of the alveoli in the breast is caused by, the correct answer is B, which is progesterone. 29. The lining of the uterus is formed by, the correct answer is D, which is columnar epithelium. 30. During the process of gametogenesis, the male and female sex cells divide and then contain, the correct answer is B, which is a haploid number of chromosome in the nuclei. 31. Human chorionic gonadotrophin is found in the correct answer is A, which is urine during pregnancy. 32. The rupture of membranes at term includes all of the following except, the correct answer is D, which is spontaneous labor within 12 hours. 33. By performing an abdominal palpation, the nurse or midwife should ensure the following except, the correct answer is B, which is called compression or prolapse. 34. The normal uterine contractions originate from, the correct answer is A, which is conua. 35. In vertex presentation, the fetal head usually enters the pelvic inlet so that the anterior-posterior diameter of the head occupies which plane of the pelvic inlet? The correct answer for 35 is C, which is transverse. 36. In the fetal skull, the lambdoidal suture lies between two. The correct answer for 36 is D, between two parietal and occipital bones. 37. One of the following is not true about the physiology of second stage of labor. The correct answer is B. The presenting part reaches the brim. 38. An increase in vaginal secretion during pregnancy, known as leukorrhea, is caused by increased. The correct answer is C, production of estrogen. 39. The perineum lies between the vagina and the rectum. This structure has, the correct answer is C, which is a tendon to which muscles are attached. 40. The shape of the cervical os in nullipara is, the correct answer is B, which is transverse. 41. Monozygotic twins, the correct answer is B, develop from more than one ovum. Develop from a single ovum rather. 42. The inner lining of the non-pregnant uterus is called, the correct answer is C, which is endometrium. 43. In first presentation, the denominator is, the correct answer is B, which is mentum. 44. Vaginal bleeding before 28 weeks of gestation is commonly due to, the correct answer is A, which is threatened abortion. 45. Coitus during pregnancy could be contraindicated in the presence of, the correct answer is C, which is premature rupture of membranes. 46. When assessing the adequacy of pelvis, the nurse or midwives feel for the following except the correct answer is A, curvature of the spine. 47. In type 2 classification of placenta abruption, the correct answer for 47 is C, which is placenta reaches the cervical os but does not cover it. This is 48. Which placenta hormone predisposes the pregnant woman to gestational diabetes? And the correct answer is B, which is human placental lactogen. 49. The deliberate initiation of uterine contraction prior to their spontaneous onset is referred to as, the correct answer is B, which is induction of labor. 50. The sinking of the fetus in the lower pore of the uterus in the late pregnancy is termed, the correct answer is B, which is lightening. We move on to cross-match, and in terms of cross-match, the first set of cross-match says, match the following menstrual irregularities in column 1 with their appropriate description in column 2. And 51 says menorrhagia, the correct answer is B, which is menstrual periods. So here it's B, which is menstrual periods are excessive in both amount and duration of flow but occurring at regular intervals. 52, oligomenorrhea, the correct answer is A. The correct answer is A, which is a menstrual period occur at intervals of more than 35 days. 53 says metrorrhagia, the correct answer is G. And G says uterine bleeding, usually not excessive, occurring at any time during menstrual cycle other than during normal menstruation. 54, hypomenorrhea, the correct answer is F. And this is where there is uterine bleeding that is regular but decreases in amount. 55, polymenorrhea, the correct answer is C, and this is where there is menstrual periods, frequent but regular episodes of uterine bleeding occurring at intervals of 21 days or less. We go on to the next set of matching from 56 to 60. So 56 says fundus 2.5 centimeter above, and this one says match the condition in column 1 with their description in relation to placenta separation in column 2. So 56 says fundus 2.5 centimeter above umbilicus. Here the correct answer is C, which is placenta still in the upper segment. 57 says fundus 4 centimeter below the umbilicus. The correct answer here is B. And B says placenta separated and in the lower segment. 58 says fundus 1.5 centimeter above the umbilicus. The correct answer is D. And D, this is where the placenta is expelled. 59. 59 says Matthews-Duncan method. The correct answer is F. This is maternal surface seen first at the introitus. Then 60 says Shoes method. The correct answer is A, fetal surface seen first at the introitus. The next set of matching says match the hormones in column 1 with their function in column 2. 61 says follicle stimulating hormone. The correct answer is B. 62 says progesterone. The correct answer is A. Then 63, so B says promotes activity in granulosa cells resulting in conversion of an androgen into estrogen. Then 52, the answer for A says the answer is that it stimulates growth of the endometrial glands and make them more tortuous. 63 says gonadotrophin releasing hormone. The correct answer is E. And E says triggers cyclic changes during menstrual cycle by stimulating secretion of gonadotrophins from the hypophysis. 64, estrogen. And estrogen, the answer is D. This one responsible for repair of damaged endometrium by proliferation and development of uterine glands. 65, the luteinizing hormone, the correct answer is C, necessary for maintenance of corpus luteum. We go to the last set of matchings. It says match the contraceptives in column 1 with their function in column 2. And 66, we start with implants. The correct answer here is F, which is these are flexible plastic containing synthetic hormones inserted under the skin of the glans upper arm, which slowly releases hormones into the bloodstream. 67, IUD. The correct answer is B. It prevents fertilization by impeding sperm transport. 68, this one says injectables. And the correct answer is C. And C, this is synthetic progesterone, which inhibits ovulation and thickens the cervical mucus to prevent sperm from passing through. 69, pill. The correct answer is A. Stops ovulation by inhibiting the production of follicle-stimulating hormone and luteinizing hormone. 70, which is the female condom, and the correct answer is E. A strong, odorless, transparent sheath that transmits heat and lines the vagina to create barrier against sperm and STI. So that is how we can answer the cross match. We move on to completion. And 71 says the dash diameter of is the largest at the brim of the anthropoid pelvis. The correct answer is antero-posterior. 72, labor that exceeds 18 hours in spite of good uterine contraction is referred to as, the correct answer is prolonged labor. 73, dash can be damaged if an episiotomy is lateral rather than mediolateral. The correct answer is anal sphincter. 74, a blowing mama synchronous with the maternal pulse as a result of increased blood flow during pregnancy is called, the correct answer is uterine sulfur. So sulfur with this spelling. 75, pigmentation of the facial skin in pregnancy is known as closma or cloasma. 76, ocult edema may be diagnosed by detecting excessive. The correct answer is weight gain. 77, if a woman has a regular menstrual cycle lasting 42 days, it will be the dash half of the cycle, which will be extended by 2 weeks. The correct answer is follicular or proliferative phase. 78. Vaginal examination should be performed when the membranes rupture to exclude. The correct answer is called prolapse. 79. Labor may be accelerated if progress is slow, provided there is no evidence of moderate or severe. The correct answer is fetal distress or cephalopelvic disproportion. 80. Oxytocin is produced by the posterior pituitary gland and acts on the dash in the breasts. The correct answer is myoepithelial cells. 81. The primary stimuli to lactation is, the answer is sucking. 82. Severe postpartum hemorrhage can leave the woman with the Sheehan's syndrome, which is caused by necrosis of the correct answer is the pituitary gland. 83. Oxytocin has an antidiuretic effect and should be administered in large doses in order to prevent. The correct answer is water intoxication. 84. The 3 criteria for lactation amenorrhea include amenorrhea less than 6 weeks, postpartum, and the correct answer is the exclusive breastfeeding. 85. Postpartum sterilization is best carried out within days of delivery when the uterus and uterine tubes are still abdominal organs. The correct answer is 7 days. 86. When the cord is placed by the side or is pressed, it's placed by the side of the presenting part and is not felt by the fingers on vaginal examination is cord. The correct answer, of course, is ocult prolapse. 87. Pain felt on the calf, on the dorsiflexion of the foot in puerperal period is known as. The correct answer is Homanzi sign. 88. Dash is the taking up of the cervix as the muscle fibers surrounding the internal os are drawn upward by the retracted upper segment of the uterus. The answer is effacement. 89. Abnormal vaginal bleeding between periods or after sex is an early sign of. The correct answer is cervical cancer. 90. A multiple pregnancy with 5 fetuses in utero is called. The answer is quintuplets. 91. The number of babies born after 28 weeks of gestation, regardless of the outcome, is known as. The correct answer for 91 is parity. 92. The document that contains the woman's preferences in terms of delivery center, the delivering midwife, is referred to as. The correct answer is, of course, birth plan. Or, of course, 92. 93. The area between the anus and the vagina is called perineum. 94. The vaginal walls are pink and their texture is not smooth as they are composed of numerous transverse folds called. The correct answer is rugae. 95. The vulva is supplied with blood from 2 main arteries, namely dash and dash, and this is the internal pudental artery and external pudental. 96. The failure of the cervix to dilate despite normal uterine contraction is called. The correct answer is cervical dystocia. 97. The commonest cause of high head at term is. The correct answer is cephalopelvic disproportion. 98. The station of the presenting part in the level of presenting part in relation to the correct answer for 98 is ischial spines. 99. Occasionally in twin pregnancy, one fetus may die in the second trimester and become a. The correct answer is fetus papyrosus. So the child may become what is known as fetus papyrosus, and the spelling is this. The last question, 100, says, the dash is the method used to assess the ripeness of the cervix before labor. The answer is Bishop's score. So this paper for November 2019 had essays to do with ectopic pregnancy, the other essay to do with postpartum hemorrhage, and the third essay to do with postnatal care. So this is where we end today. Till next time, goodbye.